In South Carolina has confirmed its third measles case this year. Health officials say an upstate resident who recently traveled abroad is now isolating at home. This latest case has sparked questions about the disease. So this morning we are on your side, separating fact from fiction with Dr. Brannon Traxler, Chief Medical Officer for the South Carolina Department of Public Health. Good morning.
Good morning.
Yes. Okay, so let's start with this. What exactly is measles?
Sure. So measles is a virus that causes upper respiratory symptoms. So we think about it, nose, throat, very much like the common cold. Unfortunately, it can cause a lot of other severe symptoms as well. When it first starts out, usually it'll cause a real high fever, and then the irritation of the eyes, that runny nose, as I mentioned, congestion maybe to go with that. Sometimes you'll get some white spots on the roof of their mouth, which is pretty specific to the measles virus. That then progresses to a full body rash.
Wow, and you're taking a look at that on your screen right now. So how serious can measles be and how does it spread?
Certainly. So for the majority of people, thankfully, it's a self-limiting diagnosis. It'll resolve itself. You treat the symptoms. However, 1 in 5 people in the modern era have to be hospitalized who end up with measles. So it's not an insignificant percentage of people, 20%, that are requiring hospitalization. And when you look at children, we really worry about the most severe complications of things like pneumonia or potentially even death or brain swelling that can occur. 1 in 20 kids that get infected with the virus will end up getting pneumonia. And that's then the most common reason that they die.
Yeah, pneumonia is so serious. So one of the things that has been spreading around social media is how measles spreads. How contagious is it? So let's just clear that up now, because I think I've heard a little bit of everything.
So measles is spread through the air, just like if you and I are sitting here talking, if one of us was infected, I promise I'm not, but then we could be spreading it to each other. It is one of the most, if not the most contagious viruses that we know of out there in terms of being able to spread through the air like that. We know that if you put 10 people in a room with somebody who has measles and is infected, and those 10 people don't have immunity, 9 out of those 10 are going to end up infected.
Wow.
And it can hang out in the room for 2 hours after the infected person leaves as well.
So that's good information to know. So speaking about spreading and it being contagious, are we or should we be concerned that we have 3 cases so far this year in South Carolina?
So we are seeing an uptick in cases really internationally as well as nationally. So it is not surprising that South Carolina the trends are really following what's occurring elsewhere in the country and internationally. What we don't want to see is that these sporadic cases that are often travel associated become further outbreaks. That's what we really would be concerned about, would be spread of the virus, especially if it's not just within a household, but spread outside of a household here within our state. And we have not seen that yet in 2025, but it's certainly something we're monitoring very closely and trying to prevent from happening.
When you monitor this, what does that look like? What are the steps? Give us like the inside science, the behind the scenes.
Certainly. So measles is a condition that is immediately reportable to us. So some conditions, they can, doctors and labs can wait till the next day. We'd prefer they wait till the next day, to call. This is one, if they suspect that they have a case of it, we want them 24/7 to call our epidemiologist or one of our physicians is always on backup call anytime, day or night, and we'll walk them through it. Whether they get the testing done through their testing centers or whether we get the specimen brought to Columbia. Our lab that's certified can do the confirmatory testing for measles. It's a nasal swab, similar as what we all unfortunately remember from COVID.
Yep.
And so that is the ideal test, is that swab. And so it's a PCR test. We then, as soon as we get those results back, our team has often, usually based on just the information the provider gave them, been kind of mentally thinking through what is the risk of this being actually a positive test. What are the risk factors for this person? What do we need to take into consideration? And so they jump into action with the positive test result and they talk to the person. Obviously, the care of the person medically is the first and foremost, and they make sure the providers and healthcare workers are wearing the right protective equipment. But then also they start interviewing the person and doing that case investigation to see where they've been and who all they might have exposed.
So what is the best way to protect yourself from measles?
Absolutely, it is 2 doses of the MMR vaccine. So one dose will give 93% of the population or people who get it immunity lifetime, don't need a booster. Giving a second shot of it a few years later will capture another 4%. So that'll get us at 97% of people being protected just from those 2 doses. And so that is really the absolute best way. It is lifelong then. Most people don't need a booster if they had those 2 as children. And it is very safe and very effective.
I was just about to ask that, how effective is it? Now, when it comes to measles, is there a group or population that is at higher risk? Is it older adults, young people, children?
Yes, so we always look at the 2 kind of more extremes of age, and yes, older adults, especially children though, for measles. Also pregnant people, pregnant women, and then anybody who's got underlying serious medical issues, especially if they're immunocompromised. And I will note that because it is a live vaccine, people who are pregnant at the moment or are immunocompromised, we really especially recommend, not just everyone, but those in particular, talk to their healthcare provider because they might be recommended to delay getting the doses.
And speaking of your healthcare provider, when is it time to start going to the doctor because you think something's just not right here?
So the first thing we ask that you do, please, is pick up the phone and call your doctor if you think that it's something that could be like measles. Please don't show up at a doctor's office, at a clinic, at an ER, and walk in and sit in the waiting room, potentially exposing everybody else. So we ask, when you really can't treat your symptoms at home anymore, or if you know that you were exposed to the measles virus and are not protected from immunity and then develop a rash, those are all reasons to call your doctor. But again, please call ahead, follow their instructions they give you for how to proceed.
That is so important. I'm glad you covered that because we've just learned that it is so contagious. And so y'all be fair to the other people that are going to the doctor's office. And that's why it's also important to understand the signs and the symptoms so you can know, could possibly be measles, so I need to stick back. All right, so big picture here. There's a lot of misinformation out there about measles. Is there one thing that just stands out above the rest that you're like, this is not true, but people keep believing it anyway?
I think that the one thing is that it did used to be a very common childhood illness. And so people assume, therefore, that it is a benign, innocuous process that kind of one of those rites of passage that, a generation above me at least, they all got it. And I think a reminder to them and everyone is the children who didn't recover fully from it aren't around to remind us of that. So yes, there are a lot of adults, we all have them in our families, in our life, that are saying, but I had it as a kid, it's not a big deal. But the ones who for whom it was a big deal are not around to remind us of that.
That's definitely a sober reminder there. Okay, so if you want to get the MMR vaccine in order to protect yourself, how can you do that? Do you go to your PCP? What does that look like?
Certainly. So for children, absolutely talk to their primary care provider and wherever they get their routine childhood shots. For adults, this is one that can be given without a prescription at a pharmacy. So you can talk to your provider. We always recommend for all vaccines, talking to your provider to find out if it's right for you. But this is one where you can go to a pharmacy and get an MMR without a prescription if you're an adult.
What are the general recommendations when it comes to age for getting the vaccine?
Sure, so we recommend the first dose be around 12 to 15 months old. So many kids will get it as part of their first year well check. And then the second dose usually is given at like the 4-year well check in time for them to have protection before they enter kindergarten. And then for adults, if you were born before 1957, statistically you pretty much had measles. So you don't have to worry about getting a dose. But, however, you will not hurt yourself if you did, just if you don't know or if you're uncertain. And so then for any adults that are traveling abroad, because there are so many cases going on internationally, as well as any children 6 months and older, we recommend talking to the primary care doctor and seeing if they recommend a booster or an early dose if it's a baby.
Okay, you guys, that was a lot of good information. Thank you so much for clearing all that up, because I think one of the things that makes it difficult to navigate that space is when you have misinformation. And so it's so good to know exactly what this virus is, how it can impact you, signs and symptoms, and ways that you can protect yourself as well as your family. Dr. Traxler, thank you so much for joining us this morning.
Certainly, thank you for having me.
Absolutely.